Welcome to the Care Right podcast, your go-to resource for all things elder care. Guiding us through this journey is Annalee Kruger, the founder of Care Right Incorporated, and she has been steadfastly supporting families across the United States. Each episode brings you expert insights, innovative strategies, and practical advice, ensuring that you're well equipped to provide the best possible care for your loved ones. Expect to gain valuable knowledge, learn from real-life stories, and get inspired to take action in your own caregiving journey. So buckle up as we dive into an in-depth discussion of elder care planning and together embrace the journey of caring for aging loved ones on the Care Right podcast.
Hi, I'm Annalee Kruger with Care Right Incorporated. We work with families all across the country in the United States, developing customized aging plans. Most of the time, the family members or the people who call us for services are the burned out family caregivers, the sons and the daughters who are really exhausted. They've been mom and dad's assisted living for a period of time, or they've been just flying back and forth or coming to check on their parents as often as they can, sometimes every couple weeks, sometimes once a month, and they're just burned out. It's hard to juggle your career, your family, your own health, and your relationships with your family, your siblings, and your care recipient when you're constantly going back and forth, checking on aging parents every time they have a fall or a hospital stay. So we work with families across the country. We've been virtual. I started my company in 2011. We've been virtual since 2012 because families just don't live near each other. So we facilitate their family meeting. We find out what's working well, what's not working well, what are your goals as you age, what resources do you have in place to help pay for those goals, like aging in place at home, and what are the considerations that you need to be thinking about as far as caregiver issues, health issues, dementia progression, and the cost of care, and where you're going to receive that care at home or at some point into a care community and what that all looks like. We teach our clients how to be bold advocates because the healthcare industry is in complete turmoil and the quality of care delivery has plummeted since the pandemic. So we teach our clients how to be bold advocates. We teach our clients what are the differences in levels of care. Most of the families that come to us have no idea what the differences are between independent living, assisted living, memory care. So we teach that. The Care Right Aging Plan is a lot of just educational curriculum so that families can then make informed decisions on what's right for them. But we guide our clients through that whole entire process. It's very hands-on, or I should say Zoom on process, but that way we help our families get their lives back on track so they can get back on track with their health or their own families and their careers. So one of the goals with a Care Right podcast or the Caregiver Crisis podcast is really I try hard to find really top-notch podcast guests that are doing amazing things and that are helping families in areas that they all need to be helped in. So today we're going to be talking with David today. He's a financial planner, but David also he's a Medicare specialist. And it's so important to have a whole team of professionals that you're working with as you're aging. And that's the Care Right method is we use a collaborative approach. We truly are a comprehensive planner because we look at all of these different aspects. And so David is someone that I've used for many, I've referred you a lot of clients, several in the last few years that we've met. And as you can imagine, most of my clients, because they come to me in crisis, their family relationships are very strained and their parents are pretty medically complex. And they're usually in a state of transition with moving from home or moving from one state to another state to be closer to their kids. And you need to be thinking about your Medicare plan that you're on because that definitely will change when you move or when you have a change in your condition that would require you to be able to change your plan and save a lot of money potentially if you do it the right way. So I want to introduce David. Let me pull up your biography. You've been serving clients in a holistic financial planning capacity for 14 years. He was a chemical engineer coming out of undergrad, and then he went into corporate finance. And now he's been in his dream career for 14 years, serving clients as financial planner and helping them with sorting out what their Medicare insurance options are. So David, welcome. And I'm excited to have you as a guest today. We'll go ahead and get started. Because this could actually be like a full hour kind of podcast, but we just want to give consumers or families just enough information to really get them thinking about, okay, what are we on the right plan, and do we maybe need to schedule a call with you, David, to kind of sort out what our options might be. So a couple things that we want to talk about today is a timeline to consider for enrolling into Medicare initially.
I appreciate that intro very much, Annalee, and initial question. Welcome everyone. Thanks for listening in here. I've really enjoyed, number one, Annalee, working with you and helping those cases that you brought my way. It is Medicare planning and just elder planning is certainly a complex situation. I have not always lived in this Medicare and insurance world my whole career, the last 14 years. Early on, I focused mostly on just investments and income planning for individuals. But as more and more of my clients were approaching this phase of an important phase of enrolling in Medicare, at the time, I just was not well versed, and I would always have to ask them to go seek other counsel. And I said to myself, why am I doing that? If this is an area that I can add value in some capacity and help people take those pain points out of the equation, why wouldn't I want to become educated myself and learn more about it and be that trusted resource as much as possible? And the more that I delved into it, Annalee, the more that I realized it is a really complex plan and a set of choices that people have to make. It's not just a one-stop shop. You make one choice and it's all done with. There's multiple components of Medicare, as I'm sure those that are on it can attest to. And I'll share the importance of getting good counsel has become elevated by virtue of COVID happening a couple of years ago. When COVID happened, many don't realize that a lot of the Social Security offices where people historically were able to walk into and speak live in person with a customer service rep, and they have great representatives all across the country. But those offices have in essence shut down by and large in almost every scenario. So now individuals are subject to enrolling online themselves, at which point you have to make those decisions that you may or may not be sure exactly the right way to go. Or you have to make, schedule phone calls with those representatives. I have really taken it upon myself to be that, offer that white glove approach to my clients, because I want to make sure they know they have taken care of those options. They have evaluated all the options available to them and made a choice that in retirement, as we all can attest to, I think health insurance and healthcare is one of the biggest risks that we all face. And we want to make sure we have good comprehensive coverage as much as possible, not just one-time election at inception when you first become eligible for Medicare. For almost all folks, it's age 65. But throughout the years, you'll have these opportunities to evaluate and see if making an adjustment to those plans is available if your current plan that you've chosen is not working out in the best way, or if your health conditions have changed, or your medication list that you are on, maybe that changes from year to year, and the formularies are adjusting within the company. So just know that it is a pretty complex area. You have choice, and those that spend more time evaluating those options up front and throughout the years, you're going to end up saving a lot of money and getting more peace of mind that your health insurance options are chosen wisely, and you're more informed at the end of the day. So,
and one thing I wanted to share too, well, a lot of things, but one thing is that, not only the COVID dilemma of all these offices being shut down, but I can tell you that a lot of my clients that are still living at home, and heck, for those that are anybody in front of a TV, any senior in front of a TV during open enrollment, I can't tell you how many of my clients that have like just a smidge of, memory impairment or just really concerned about their insurance. They'll call those 800 numbers on the Medicare and they change their plans constantly. One of my clients, or a couple of my clients that I've referred to you, that's exactly what they were doing. Pretty much every time they saw a commercial, they get on the phone because they have memory impairment, and I'm like, oh my goodness. But the other thing I want to bring up too, because I did a webinar on this the other day, and people, to consumers and families, don't realize, or seniors don't always realize, that depending on what you have for insurance, it's one thing when you leave your home, but then if you go into a skilled nursing or a skilled rehab unit, not all of these skilled rehabs contract with all the different Medicare providers, right? And so that's one of the reasons why hospitals were backed up, so to speak, during COVID, is because they had to wait for the facility that has a contract with these carriers to have an open bed. And so I know a couple of my clients that I sent to you, that was the case with them, is they didn't have any other options, because in the area that they lived in, there's only 3 facilities, 3 skilled rehabs that actually contracted with the insurance carrier that they had. And so that's one of the reasons I referred them to you, because this is not my area of expertise. This is way too complicated. I stay in my lane and I just bring people onto the team who have the expertise that we need so that these families have the best outcomes. But maybe you can just touch on that for a minute, about how you really need to be mindful of your health, where you're going to live, where you're going to receive care, because you may be one of those people that's stuck in a hospital for a week or two, waiting for an open bed with a facility that contracts with your current insurance plan.
Yeah, great scenario that you brought up, Annalee, and in your case that I think you're referring to, as a lot of your clients are subject to, the adult children who are healthy and taking care of their mom or dad are in one state, and their parents are in a different state, using those different insurance plans that may or may not contract with the local skilled facilities. And so when they're in a position where that family member, that mom or dad, get hospitalized and then will eventually get discharged, you have to look very explicitly at who their insurance provider is and whether or not they contract with all the skilled local facilities, or if it's only on a select few. I think you're referring to, in this case, when a consumer becomes first eligible for Medicare, in most cases at 65, they have a 3-month IEP window before their birthday month, and then 3 months after. That window gives all consumers an option to pick and choose among lots of different options there. Guaranteed issue, open enrollment, no medical questions. They have to accept you. And that decision that you make at 65 might be something that you can look 20 years back later while on Medicare. All of a sudden you can say, I wish I would have chosen a little bit differently there. When people first enroll in Medicare, keep in mind there's A, which is hospitalization, and B, which is outpatient. So inpatient and outpatient there. In addition to A and B, there's gaps in coverage. There's deductibles and copays that people are subject to. So we always advise people to elect the other components of Medicare to cover those gaps, so to speak. And in most cases, unless someone is a retiree of a corporation where they have a pretty solid retiree health insurance plan, most consumers, when joining on Medicare, can choose either the avenue of choosing a combination of a Medigap plan with a Part D drug plan, or they can go down the pathway of a Medicare Advantage plan. There's pros and cons to each choices. There's costs to each option there. I will say the option, when you think about years and years down the line, when your health is starting to go downhill and you are facing more and more need for care at the end of the day, if you want to have more flexibility and more likelihood that those facilities may cover you, I tend to look at the Medigap with drug plan combination as a more flexible type of coverage there. There's typically more upfront premium or costs related to those, but on the back end, there's not going to be as many restrictions or things that you have to double check with the Advantage plans, they can also work out very well for consumers in retirement. So I'm not advocating one way or the other, folks. Please keep that in mind. I think there's pros and cons to each. There's no perfect plan out there. But with the Advantage plans, as you get older and as you face hospitalizations potentially and or discharge and need to go into a skilled facility, those Advantage plans have direct contracts with specific facilities or with doctor networks, so to speak. So it's important on those types of plans that you understand what you're getting into in terms of, will those providers that you want to use, will they always be contracted with that Advantage plan insurance company at the end of the day? And you'll find that over the years, as you face situations, you might have choice to switch if your current program is not working for you. Under the Advantage plan world, there's windows or windows that you can make an adjustment to find a better plan that will contract with those facilities that you would like to use. So that's where it gets really nuanced and a lot of technical rules that you have to double check. I do a ton of homework for folks in those situations to make sure before we make any switches, we want to make sure it's providing as much comprehensive coverage with the doctors, with the medications, so that they can get the care that they need and families can focus on what matters most, which is ultimately getting that family member better again, if at all possible.
Yeah.
So hopefully that explains a little bit there, Annalee.
There's just so much there's so much involved in these decisions that families, Google will only get you so far. And if you go on the internet and try to, do this on your own, there's so many things that you need to think about. Like, do I have to switch doctors if I switch plan? There's just so much that families need to think about, and they don't, because they don't know what they don't know. And so then they make really expensive decisions, and that us as professionals have to try to undo if we can. Sometimes the damage is already done.
Fortunately, these things on Medicare are not taught in school when we grow up there. So this is all very much do it yourself. That people are on their own trying to help identify and evaluate. And the Medicare rules are not simple. They're fairly complex. I am a huge believer that Medicare is a wonderful program out there. It's the largest group health insurance plan, so to speak, in the country. So it really can be a great payer. It doesn't pay everything. So half of one's experience is your expectations walking into whatever that plan is that you have chosen at inception or made a switch to over the years there. To your point about people seeing lots of commercials while they're at home in retirement, wondering, am I on the right plan? Should I call up and make a switch? That actually happens within my family. We have a grandmother that loves to watch TV from time to time, and she's like, I think I can save money on my premium. I'm like, Grammy, please don't change. Thank you for calling me and telling me, but please don't change. You've got a great setup right now, and it doesn't need to be adjusted at this point in time. So that's why it's so important to be upfront and close and have a relationship with your family members to get a gauge on, are they making good decisions, or are they considering options that may not be optimal for them in the future?
Right. And sometimes you just don't know until they've already done it, and when you think about during COVID, they were in a forced shutdown, right? They were like locked in their own homes practically.
Right. And
what did they have to watch? But it was all, during open enrollment. So I'm sure that in the insurance industry, they saw a skyrocket of phone calls just because of that, because they were lonely and they have some memory impairment. And when you're in lockdown and isolated from people, it affects their cognition and their anxiety and so forth. So I'm sure they were calling those 1-800 numbers just to.
And it's great that they're trying to be informed consumers. They just don't know all the ins and outs.
That's
right. At the end of the day, maybe it's a right decision for them, but we want to make sure that they're making the right decision at the right time, and they're getting the proper consultation to evaluate all the ins and outs of that switch if they're going to be doing that at the end of the day.
That's right. That's right. So there's a lot to take in, and I feel like we kind of like threw a bunch of like probably new information out, just like some different things that families maybe hadn't considered or thought of before. Right. So David, your company is one-to-one financial advisors. You're based out of Indiana, but you're licensed in a whole bunch of different states. and we met a 3 years ago when you went through the elder planning specialist program through my other company, Plan for Life. So one of the cool things about you, David, is that you are a CFP, a certified financial planner, but you've also been through the elder planning specialist program. So we've trained our advisors, we've trained advisors to be more mindful and alert about, aging issues, caregiver burnout, and dementia or diminished capacity. So you've had that extra training, you've invested in yourself, which equates to you've invested in your clients because you wanted to learn more about your aging population that you're taking care of. And that's also why you went more into that you do Medicare planning as well. So you're in Indiana, but you're licensed in a whole bunch of different states. You're always my go-to when I have clients that we are needing to look at, a move or a major health issue change or changes in their medications. I always send them your way because you've always come through with really, really good options for my pretty complex clients. So is there anything before we wrap up? Is there any, how can people get a hold of you? What's a good way to reach you?
Yep, sure. Number one, I appreciate you giving that background, Annalee. It's been wonderful for me. I learned about you and your organization and the elder planning class through your colleague, Bob Matterstock, who came and spoke at a local financial planning association meeting I was sitting on the board of at the time. I brought in the speakers, and I was just so engaged in what Bob was talking about with his own story, with his dad who was going through Alzheimer's at that time. And I'm like, why am I not delving into this world of helping families? Because this is when it really matters. This is when you see value at the end of the day for the professionals that you have, building a team around you. And I wanted to be part of that team for my clients because I really love helping them, not just during the good and bad, the up days or the down days in the market, but it's all the other things that add value and add peace of mind for building an appropriate financial plan.
Right.
So
and it boggles, like when I started Plan for Life, it was because I had met all these financial planners because I used to support the Wisconsin FPA, and I met all these financial planners, and they're simply not talking about aging and caregiver burnout, and it just boggles my mind how a financial planner can ethically put a financial plan together without addressing these very key issues that are the highest risks for most people's aging years.
Right.
so
I keep getting the word out about what you and your organizations do at the end of the day, Annalee, because it is so powerful. At the end of the day, if we can add value in some capacity to a family, to a client, to give them peace of mind that they can focus on the relationships and the care, the money side of things is not nearly as important at the end of the day. So number one, thank you for your partnership, for trusting in me. I take every person that you send my way. I want to make sure I provide as good of information. If I don't know the answer, I have really good connections in my world to get those proper answers with the different departments of insurance I go to all the time for unique situations. If family members, if individuals listening in have any questions or would like to talk to me about your own scenario, whether you're getting ready to enroll in Medicare and want to explore all your options, or if you're already on it, or if your family member is on a plan and you're not sure if it's truly providing the proper coverage or providing the most expansive opportunities to get access to doctors as best as possible, I'm happy to help touch base with you. It could be a simple phone call. My direct line at work is 317-819-7350, or my cell is 317-918-2241. Certainly folks can just ping Annalee and she has my contact information. And I have an email address. It's a pretty long one, so I don't know if there's a better way to publish that out there if people want to connect with me. But those phone numbers are really the best way to touch base. I'm happy to take your call. And if I can help you, I'll let you know. If I can't, I'll try to point you in the right direction. I just want people to walk away with a better sense and understanding on are they in a good place, or can they be in a better place with their Medicare options? Because you want to focus on family and health recovery as best that you can there.
Yep, absolutely. Well, David, I think our time here is done for today's podcast. This has been amazing, really great content, lots of nuggets for people to take away. And thank you for taking the time to talk to my group that I have that watches these podcasts or listens to these podcasts as well. So
can I say one piece? So folks listening in, if you've not known Annalee, she is awesome at what she does with her Care Right organization or other organization. So truly she has an amazing ability to help people navigate truly complex scenarios. And it's hard, especially if you're far away from family. So ping her, see if she can help out in some way, alleviate the stresses that you're feeling on a day-to-day basis with your family situation. So I've seen her in action, and I'll say that you're awesome, Annalie.
Well, thank you. Thanks, David. I appreciate it. So with that, we'll close for today. And thank you, everyone, for listening to today's podcast. Have a wonderful day and stay safe.
Thanks, folks. Take care.
Bye.
Thank you for tuning into the Care Right podcast. We hope today's discussion has provided you with valuable insights. If so, don't forget to like, subscribe, and share our podcast with others who might find it helpful. Remember, Care Right is more than just a podcast. It's a community dedicated to supporting family caregivers with comprehensive care planning, crisis management, and resources for every stage of aging. Stay connected with us for future episodes as we continue to explore essential topics in aging planning, elder care, and financial planning. Until next time, take care, plan wisely, and remember, you're not alone in your caregiving journey.